Hi everyone, welcome to today's Dysphagia and Feeding Technique Nutrition in Service. I'm the dietitian at Buchanan Lodge. So first, let's look into dysphagia. What is dysphagia? In simple definition, it means difficulty swallowing or difficulty eating. So what's the prevalence of dysphagia in long-term care population? What percentage of the residents might have dysphagia? So the number could be shocking. It's 16% to 17% to 70%. I know it's a big range, because it depends on the facility, the number could vary. But a lot of the residents here in long-term care are actually have signs and symptoms of dysphagia. If we look at the relationship between dysphagia and aging, we know that for people over 65 years of age, they have 7 times higher risks for choking on food than children aged between 1 to 4 years of age. So dysphagia can be a really severe problem for the senior population. If we compare the mortality rates in frail elderly with difficulty swallowing, is 56% versus only 15% in frail elderly without any problem swallowing. So that's why we emphasize on this topic every year, so that we can better help our residents with their eating. So I have a video on dysphagia, so let's watch it together. So this is a video showing you what exactly happens when someone swallow a liquid. So on the left-hand side is normal swallow, and on the right-hand side is abnormal swallow in case of dysphagia. So let's watch it together. So in the case of normal swallow, so you can see the drinks go down to the stomach easily without any issue. But in case of dysphagia, you can see that the fluid was stuck in the wrong pipe, was also go to the lungs. And it also takes that resident several attempts to swallow one sip of fluid. So let's go back to the slides here. So what are signs and symptoms of dysphagia? So we can see that so some signs could include difficulty starting a swallow or needing several attempts to swallow a mouthful of food. And very commonly, you can see that people are coughing or even choking while they're eating or drinking. Sometimes we also observe that food or drink going into the nasal cavity, or food or drink leaking out of the mouth when eating or drinking, like drooling is very obvious sign of dysphagia. We could see trouble swallowing saliva, possibly leading to drooling. We could also see food is often left in your mouth or throat after swallowing, just as we just saw on the video graph. We could also hear gurgling or wet voice when they talk after swallowing food or drinks. And the residents might experience pain while they swallow their food. And also chest infection or pneumonia could be observed as well. And weight loss related to eating or drinking less is also a sign and symptom. There are also sudden or gradual change in eating or drinking habits, or not wanting to eat, avoiding certain food or drinks, taking a long time to eat or drink. This is also a common sign of dysphagia. So the residents might chew and chew and chew the food for a long time and not really swallowing. And we also call this sign pocketing. You could also observe social isolation and or desire to eat alone. Just a reminder that not all residents with dysphagia have signs and symptoms. There's something called silent aspiration, meaning that someone might have dysphagia but doesn't really show any signs and symptoms. So what happens if we don't do anything with dysphagia? We could observe that the residents might have malnutrition or dehydration over time. There's increased risk for pressure ulcers. There could be higher risk for pneumonia. So overall, we see decreased quality of life for the residents, and they might not enjoy their meals. And in the severe case, if someone cannot tolerate food by mouth safely, they might need tube feed eventually, and we could see a repeated hospitalization. In the very severe case, if a blockage of airway happens, we can see choking episodes happening, which may lead to death eventually. So how can we help residents with dysphagia? So first of all, we have a whole healthcare team. So if you observe any of the signs and symptoms that we mentioned earlier, please send me a referral and I can go and assess that particular resident. And we also have modified diet textures and different fluid consistencies. So my job is to go and assess everybody and make sure they are on the right consistency and diet textures. And we also have safe feeding techniques, which we'll cover later of this presentation. For example, we want to make sure they're sitting in a proper position for their eating and drinking time. And also, good oral care is very important. So please make sure you follow the oral care nutrition care plan. If there is some food residual left over in their mouth, that could significantly increase the risk for aspiration or choking. And also make sure we monitor their nutrition intake and status closely. So after eating or after their mealtime, please make sure you record how much they actually eat or drink. So this slide showed you choking incidents happened all over the world. So there is like for example, 9-year-old this baby choke on shepherd's pie at nursery from UK. We also have Mona, this 95-year-old frail elderly choke on peas and carrots from Australia. So the key message of this slide is that please make sure you double check their diet order. Make sure you double check the books, which is available at each survey, so that we can make sure they receive the right diet texture and fluid consistency to prevent those choking incidents from happening. This is really important for the residents' safety. Okay, so let's move on to feeding techniques. So the first question is, who would need feeding assistance? We know that not everyone needs help with feeding. Only certain population need feeding assistance. So someone might have poor food intake or lack of interest in meal trays, and providing feeding assistance could significantly help them to improve their nutritional status. We could have residents with declined cognitive functions or physical inability to eat, or vision problems that prevent self-feeding. So these are the typical residents who might need feeding assistance. So there are different levels of feeding assistance. Some residents might just need tray setup, and other residents need help with partial feeding assistance. For example, they may need cueing, encouragement, and reminders. but they're able to help themselves for the rest of part of the eating or drinking. And some people might need total feeding assistance, which is totally dependent on us to help them with their meals and drinks. So we'll have a group activity together. So this is a dining room. It's AI generated dining room. So there are different areas that need to improve. So if you please take some time to think about what are different areas to improve in this picture. So I'll give you about a minute and then we can summarize all the findings together. Okay, so let's talk about the findings here. So first of all, we need to make sure that the residents' hearing aids, their glasses and dentures are in place. Um, so as we can see here, like the hearing aids is still on the table for this resident, and also glasses are still on the table, and the residents on the right-hand side does not have her dentures in. So that's the first finding. So we want to make sure that all their special devices or hearing aids and dentures are in place. And then, there are a few residents that are not in an ideal position during mealtime. For example, like this, I'm gonna change a color here. For example, this resident, she's not in an upright position, so we should wake her up and make sure she's sitting upright for her meals. And then this resident in wheelchair, she's sitting away from her table, so we should make sure she's sitting right in front of her table and ready for the meals. And then we have the two care aides are helping the residents where they're eating now. So this care aide here, I mean, both of them need to sit down and help the residents with feeding that way, because standing and feeding is not an ideal position. So we should sit at the same level with the residents so that the risk of choking is low. I know some residents they have a high wheelchair, so maybe sitting makes sense, but in most cases, standing is ideal than I mean, in most cases, sitting is ideal than standing. And also, none of them receive any drinks. So there is a drink card here, but no resident receive any drinks. So before mealtime, during mealtime, we should always make sure that they have their fluids available for them to take with their meals. Another point is that no one has any clothes protector on. So we'll want to make sure they have their bibs on to protect their clothes. Um, and then next, this area of this dining room looks very crowded. So ideally, we should make sure that all the residents have enough space to move around during mealtime. I mean, just like easy to get around. So we should space out their tables here. And someone also mentioned that the lighting of this dining room is dark. So we want to make sure we have enough lighting for them to eat. We have a distraction here, so the TV is on. So ideally during mealtime, we should make sure the TV or other distractions is off. So we should turn off the TV while they eat. Um, okay, and then please also pay attention to the clock. So it shows it's 11:30. Um, but ideally we should be serving lunch at 12 o'clock. So let's stick to the meal time we have here, because licensing actually require that lunch need to be served between 11:45 to 1. So we cannot serve before 11:45. Okay, yeah, I think that's all the things to improve in from this image that I want to show you. Oh. Okay, so let's move on to tray setup. So before we set up someone's tray, make sure we wash hands. This is really important to prevent the germs from spreading. Really important for food safety. As mentioned earlier, we should make sure that there assist like if there's any assistive devices like special equipment, dentures, glasses, hearing aids are all in place. We'll cover the assistive devices in the slides later on. And make sure we always check their diet order during service or before service. And make sure their cutleries are all within their reach. And then we cut up the meat or open packages for them as needed. We'll queue residents before moving to the next residence. And then here are some common assistive devices used in the long-term care setting. The first one is a rim plate. It makes things easier for them to scoop using their spoon. This is a plate guard, which is a similar idea as the rim plate. So you just add this plate guard on a regular plate to make it a rim plate. Same idea. We don't have it here, but just want to show you what other facility might be using. These are weighted utensils. It's especially important for residents with shaky hands or Parkinson's disease. Some of the weighted utensils are also angled ones. This one on the left-hand side is a nosy cup. It just make it easier for them to help them to get to the bottom of their drink. And then we have two types of sippy cup. The one in the middle is anti-spill. So if someone accidentally spill their drinks on the floor, it won't spill out. And then we also have two handle cup here. And of course, we also serve the soup in a mug sometimes. Next, I want to talk about the positioning at mealtime. So very important, please always make sure residents sit upright 90 degree whenever possible. and the residents need to be in a chin down position for eating. We should make sure they sit upright 90-degree the entire time during their meals or snacks, and also at least half an hour after mealtime. If someone is in a wheelchair or in bed, the same rule apply. So we want to make sure they're sitting upright 90-degree as close as possible. Sometimes like putting a pillow or cushion at their back or below the knees to support would make them more comfortable. I know like it's not always feasible to achieve this 90-degree, but the goal is should always 90 as much as close to 90 as possible. Here are some other feeding tips and tricks. So before you feed someone, make sure you assess and make sure residents is always awake and alert. If someone is drowsy and sleepy, compared to their baseline, it might not be a good idea to feed the residents on that day. So we should always make sure they're alert and awake. It would be really nice if we introduce the food items to residents. So for example, you can say, oh, today we have salmon, mashed potatoes, and broccoli for lunch. Because they don't always read the menu on the wall. So it will be really helpful if they know what's on their plate. As I mentioned earlier, we should sit in line with the residents and talk calmly. Um, and then if someone cannot finish all the food and drinks on their plate, the order or the things to prioritize is the protein in their meal or snacks or in their supplements. So we should try the protein from the main entree and then nutritional supplements and then soup or dessert. For residents with dysphagia, a teaspoon is always ideal because feeding with a tablespoon could be too overwhelming for the residents because you could add lots of like a huge bite um, on the tablespoon, but for teaspoon, you can really control how much you're getting to the residents for each bite. Sometimes serving smaller portion or one at a time could help them to concentrate on the eating. We could also provide fluid in between the feeds to make it easier to flush down the solid food. And make sure you always provide verbal cueing and encouragement for residents who need it. Sometimes it's beneficial to alternate the taste, texture, and temperature of different food just to keep them engaged. And please do not mix food together, especially for residents on mince and pureed texture. And we should always treat residents with dignity and respect. And please make sure you record their intake as soon as they finish feeding the resident, so that we can have the accurate recording for that. Next, I would like to share some feeding hand techniques. So this one is overhand technique. So the residents hold the spoon and you hold their hands. It's a process to remind them about eating. So this encourages some independence and help them to relearn how to eat. Next, we have underhand technique. So you hold the spoon and the residents hold your hand. Same idea, same concept as the previous one. So this helped them to remind about the process of eating. And then we have direct hand technique. So basically we spoon feed the residents directly. So next I have
The Wonder Oven Pro is an 8-in-1 non-toxic air fryer toaster oven. Now with two new.
Sorry for the advertisement earlier, but this is a video. This is a video just to summarize the important points on feeding techniques. So let's watch it together.
Feeding strategies for persons with swallowing impairments. For specific strategies, please speak with your speech therapist. Ensure the person being fed is seated upright and is not leaning back or to one side. Check that there is adequate support so they do not slide down. They must be alert, with eyes open, or able to respond to conversation. Do not feed a drowsy person. It is recommended to sit next to a person when feeding them instead of standing. This is because they may tilt their head to look up at you when eating or drinking, which may lead to coughing or choking. Feed slowly, following a pace that is comfortable for them. Check to make sure they swallow each mouthful before giving the next spoonful. Avoid overloading the spoon, as this may be difficult to manage. Stop feeding when they refuse or indicate that they are full, even if they have not finished a full share. Do not force feed, as this may lead to negative feelings around meal times. Reduce distractions during meal times, including talking, as they may choke or cough when they are distracted. Monitor if they are coughing or appear to be choking when eating and drinking, as this may indicate signs of difficulty swallowing the food and drink being served. If coughing is observed, stop feeding immediately and allow the person to finish coughing and rest. Please contact your speech therapist if you have any questions or concerns.
Okay, and just a few final reminders. The first one is about the living at risk options. So even though we make recommendations for residents about their diet texture and fluid consistency, but the residents or their family have the right to decide to live at risk, eating at risk if possible. And the second one, I've noticed that sometimes we serve the dessert um, like before even the main entree is served. So make sure we actually serve the dessert at least in the middle or after the meal entree is served. If residents eat the dessert first, they might not have the appetite for their entree, which is important nutrition for their daily life. So for next steps, first of all, please say the secret word, blueberry muffin, and then connect with Mia so that I can write your name down for the completion of your in-service. So this is a mandatory service, in-service. Okay, thank you for your attendance. If you have any questions, please connect with me directly. Thank you.